Hello, everyone. This is Dr. Eesha Tehreem. I am a GP ST1. This is my first year of training as a GP, and I'm working at Countess of Chester Hospital. And I started in February. I applied in the second round of GP. So today I'm going to tell you all about the GP training pathway for international medical graduates. So, as Dr. Mehreen told, that GP training is a 3 year specialty training in general practice or family medicine. It is split into hospital rotations and GP placements. Usually, it's a 3 years training. So usually 1 year is in the hospital and 2 years are in the GP practice, but it can be different as well. Like for me, I have hospital rotations like cardiology, obs and gynae, pediatrics, psychiatry, and then some placements in a few GP surgeries. So the eligibility criteria for GP training is that it has two rounds, round one and round two. So you need to be GMC registered for that. And after your MBBS and your house job, you need 12-month experience post house job by the time of application, because you need to get your F2 FY2 competencies signed. There is a form called crust form, which in which you get your FY2 competencies signed. So you need at least 12-month clinical experience post house job by the time of application to be eligible for GP training. And till now, it is not necessary that this experience should be NHS experience, as I can tell you that this is my first ever NHS job, and I completed my FY1 and FY2 both in Pakistan. So any IMG can apply for it without having any NHS experience, but these things can change and we are not sure about it. Nothing is predictable right now as things are changing over time. But right now, without NHS experience, you can apply for GP training and psychiatry training. Okay, so the application process is there is a website, an NHS recruitment portal Oriel. You have to apply through that. You have to choose GP as your specialty preference. You have to upload the crust form. Crust form is a form in which there are competencies expected of an FY2 doctor. FY2 means F1 is equivalent to the house job and internship in our countries, and F2 is the year after that. So we need 12-month experience of F2, and we can get it signed by any consultant we have worked with for at least 3 months in our past 3 years. And when we get the crest form signed, we have to upload on the Oriel, and then we have to prepare for the MSRA exam. There are two rounds of MSRA exam. For the February intake, there for the February intake there are 4,000 for the August intake there are 4,000 plus seats, and the exam is in January or February. But for February intake, there are less than 1,000 seats because it is the second round and the exam takes place in September. Like last year, I took the exam in September and I started my GP training in February 2025. So regarding MSRA, one other speaker also explained that what MSRA exactly is. It is a multi-specialty recruitment assessment. It is for a lot of specialties and for GP and psychiatry as well. It is a computer-based exam. It has two parts. One is regarding the situation judgment test, the professional dilemmas, and one is clinical problem solving. For IMGs, they are good at clinical problem solving. The thing that bothers them is the professional dilemma part. So if you are preparing for MSRF, you have to focus on this more because it has almost equal or more weightage, but it is a bit different for IMGs and it is a new thing for IMGs. And there is no negative marking. And in GP and psychiatry, there is no interview. The MSRA score solely determines your ranking. So if you have high MSRA score, there are better chances of getting a training at your preferred region. And offers are based on ranking plus location preference. And offers you have to when you get an offer on the Oriel, there are options of upgrade or accept, and you can either accept the offer or you can apply for an upgrade. And if there are any seats above your merit, you can get those seats as well. So you have to, within the deadline, you have to accept that offer. There is a deadline to either accept, hold, and upgrade. if you have, this is my first and ever NHS job, and a lot of people ask me that how am I finding this? So to start directly from training, so far, as far as my experience in the hospital is going, I am okay with it, and I think if you feel ready, I have done 4 clinical attachments before starting my training, so I think they played a great part in making me ready for my training, for directly starting my training. So if anyone wants, I think they can start with. But one thing is that don't think that you can do GP training if if you do not have interest in primary care. Do not come through this pathway. Only choose GP training if you feel like you have interest in primary care. Don't think of this as entry route in the NHS. Only choose GP training if you feel like you have interest in primary care. This is the only thing that I want to say. Otherwise, I don't think there are the system changes when you come from any other country to NHS. So I know that the system change is something that we struggle with. But other than that, I think it is easily possible to start directly from a training post.